everybody and welcome to my weekly Sunday 9 p.m. live video. I'm Dr. Tani Ping, consultant obstetrician and gynecologist. Today our topic is about menstrual cup. So this topic once again is requested by one of you, and today I am going to talk all about menstrual cup, about its usages and its safety issues. Okay, so we have many ways of dealing with our menses, and conventionally people have been talking about menstrual pads, but we do know that tampons also existed for a long time already. And on top of that, we also have recently some people have been promoting cloth pads, which is actually something that has existed long before the normal disposable menstrual pad has existed, but due to certain issues it has made a comeback. And over the last few years, more and more people were talking about menstrual cups as well. Actually, this menstrual cup came about 10 years back. I remember when it was first introduced in Malaysia, one of the companies did approach me at that time to promote it, and after looking at it, it wasn't that feasible at that time. And also the shape of the menstrual cup that was being promoted at that time was not so user-friendly compared to what you have today. So there are actually many types of menstrual cups out there, and also different, slightly different designs are available, okay? So let me show you what's a menstrual cup for those of you who have not seen it before. So this is a menstrual cup. So you can just buy it easily from anywhere, Shopee, Lazada. It's very cheap. And think about it, what's the advantage of using this just without thinking about other things? Just look at it. Number one, it's better than disposable pads is because this is reusable. You know, when we think about environment, we should always think about reusable products. So this thing, you do not need to worry whether it's biodegradable or not, because you're not going to throw it away. You're going to reuse it again and again and again. And of course, it's more cost effective. It's actually rather quite cheap, and all you need is just a few, and that's it. You just reuse and wash and reuse and wash. And it's so it's very cheap because you can use it for a long time, and you look at it, it's not likely to spoil in a short period of time. So I think one pair of menstrual cup like this would be able to last you for a long time. And they usually sell in a pair, partly is because there are different sizes. Okay, one slightly smaller, one slightly bigger. So mainly is to, if you compare both together, it is slightly different in size. Okay, so one will be able to keep more menstrual blood and one will be less. So, and if you look at it, when you buy it, there's always a video showing you how to use it. You're supposed to, of course, you can stuff it in like this. You have to either fold it in a way, this way, or maybe fold it in this way to go in, okay? So basically, this is a menstrual cup. So you look at it, think about it. Would you use a menstrual cup? I think it has its advantages for certain people. Number one, of course, we do not want to use disposable because we try to save the environment. Cost effective, that's number two. And also, there are other advantages as well to certain people, because there are people who develop allergies to menstrual pad. Actually, we do see a lot of people with allergies to menstrual pad, whereby every time they have their menses, then from the third or fourth day onwards, they start to feel that it's very itchy down there, so they're actually allergic to menstrual pads. And this is one of the solutions. Although cloth pads is also a solution for allergies, but cloth pads, we know that it is maybe a bit more troublesome to wash it. This one is a lot easier. We can just wash it at the toilet as well. We just pour it, we just rinse it and clean it, and then we can always just use it again. We don't actually need to bring home and wash and dry just like the cloth pad. So it's definitely a lot more practical. Okay, so when we use menstrual cups initially, when it first came out, the most important thing is, what were we thinking about? Leakage. Okay, we always worry about leakage. So because when you wear menstrual pad, we also know when it's overflow, it will just leak out, and then that's like a nightmare to all of us as women, because if it leaks out in the public, it is so embarrassing. So the first thing we want to know is whether it leaks. And at the same time, you can also use tampon. Tampon, although it's not very popular in Malaysia because it's something that you need to insert vaginally, but think about it, this is also need to insert vaginally. But also one more thing about tampons, the leakage is quite high, because sometimes you do not know how much menstrual blood you have inside, and as a result, sometimes the leakage is very high. Because if you look at tampons, it cannot actually accommodate so much menstrual blood. So there are research out there. So I went to look at all the research that has been done in all the medical journals, and I found out that there was this one big review where they accumulate all the 40-over research that has been done, which come up with more than 5,000 women who have used this menstrual cup. It is actually, in most studies, it leaks less than your pads or your tampon. In some studies, it is the same. So it's at least as good, If not, it could be better than using a menstrual pad as well as a tampon when it comes to chances of it leaking out menstrual blood. But honestly, sometimes if you really do worry, some people in the early stages, because you're not used to it and you really worry about its leakage, sometimes I will advise, it's just like when people started using tampon, I tell them if you're so worried, you can always still put a panty liner down there and see how, so that you roughly can gauge how long you need to keep the cup there. That is only for the first few cycles, you need to adjust. In fact, in all the research paper, it shows that it needs an adjustment. It is not something that you can say, okay, next time I want to use a menstrual cup and just use it and you expect nothing is going to happen. Something is going to happen actually, because you need a bit of adjustment to know how often you need to change this, when you need to change this. It is something you need a couple of cycles, normally 2 to 3 cycles, before you actually get familiar using this and use it comfortably with no problem. So you need an adjustment. So when it first came out, actually it wasn't very popular, especially 10 years ago or more than 10 years ago when it first came out, because it involves something that you have to put in vaginally, and you know, women being women in Malaysia, Asian women, many are not very familiar with putting things into the vagina, so they are not very comfortable inserting something into the vagina compared maybe to the Western population. But I think this is something that is improving with the current generation. That's why more and more women now are actually using menstrual cup. I do see quite a lot of women that come into my clinic that are actually using menstrual cup. They always ask me, doctor, use menstrual cup a problem or not? Will it cause this problem? Will it cause that problem? So they keep asking this question. So it looks like there are more and more women nowadays that are willing to use a menstrual cup. So it's about getting adjusted. So it's actually a very good thing. As I said, it's cheap, it is reusable, and also it has a much less leakage. So that is the advantages of using a menstrual cup. So now the question is, everybody wants to know, is there a risk of using a menstrual cup? Is there a risk? So based on the 5,000 over people that they did the research, okay, first thing is, some people actually get some mild injuries, because when they, especially during the first few months, the first few cycles, you're not used to it. So when you're trying to stuff it in, sometimes because you're not used to using it, so you may have some abrasion. No cuts, no tears, don't worry, this thing is so soft, it can't cut you or tear you, but because it rubs onto the vagina, so it can cause a bit of abrasion, but these are very small numbers. We are talking about less than 5 people in the 5,000 that have that, and also a small number of people find it very painful and very difficult to put it in. So that's why I say again, it all depends on you actually. It is also like the use of tampon. Some people just find it easily, just put the tampon in, no big deal, but some women find it very difficult to put a tampon in, because it is not their nature to put something into their vagina. So by right, I strongly encourage women, not just women, even girls, I feel, even teenagers, I feel, should learn to know their body. They should learn to explore their body. They should know that there's a vagina, and should put your finger in and feel what is inside. Because if you do learn to know your body, then you will not have so much problem trying to put this in or trying to put a tampon in. Because if you have placed your finger in before, you'll find that it's so easy to go in, and that is the direction. You will also know why it is, how big it is. So there are some women, they're so scared, they thought it's such a tiny hole, but it's not tiny hole, it's a very big hole, okay? So when you explore your body, you will realize that this is so small compared to your own vagina. So that is why you need to explore your own body first. If you are used to exploring your own body, then you won't find any problem trying to put this in or even to put a tampon in, okay? So in that 5,000 over people in the research, there are about a handful of people who find it very painful, difficult to insert, as well as a handful of people who actually had a bit of injury during the first few cycles. But it's just an adjustment issue. It's just an adjustment issue. You need a few cycles to get used to it. And once you get used to it, you know how to use it. It is actually very comfortable, because we know one thing about the vagina. If you put it at the right place, which is deep enough, then it should not feel anything. So you shouldn't feel anything. So it's very comfortable. So the first thing about the injury and the comfort. And then next we want to talk about infection. So we do know there is also a small risk of infection. There are a handful of people who reported some infection after using menstrual cup. Either a vaginal infection, or they feel a lot of rash down there, or they also can have some urine infection. But the numbers are very small. Again, out of 5,000 over, you get only about 5 or 6 people, or at the most about 10 people who actually experience some form of infection, okay? So again, it is very rare. But there is a few things that you need to understand. One thing is, we all know there is something called toxic shock syndrome. Toxic shock syndrome is first introduced when we talk about tampons. So when we talk about tampon, if you buy a tampon, the tampon box always right there, toxic shock syndrome. So the risk of using a tampon is toxic shock syndrome. This is also the same. And toxic shock syndrome can be life-threatening. But it only happens if you forget to take it out. Just like you put a tampon and you forgot to take it out. And then you put this, you also forgot to take it out. And that is when you can actually run into trouble and get a situation called toxic shock syndrome. Usually what happens is during the first few days of period, your menstruation is very heavy, right? So of course you're going to keep taking it out and change. If not, it's going to leak, right? But it's always the last few days, because the last few days your menstrual blood is so little. So sometimes you will like, yeah, it's the last few days already, very little blood. I'm now busy, I don't want to change. Or you may only change it when you take your bath. And you must understand that bath depends on how often you bathe, because we say we shouldn't keep this for more than 12 hours. So let's say if you were to take a bath once a day, because some people bathe only once a day, then you will keep it until you bathe the next time. It can be 24 hours. So we should never keep it for more than 12 hours. So that's the first thing you must remember. So if you're going to use a menstrual cup, don't keep it for more than 12 hours inside your vagina. Okay, that's the first thing. The other thing that you need to be careful when you use a menstrual cup is in a situation where you use a menstrual cup and also you use IUD. You know, some of us put IUD to prevent pregnancy, right? And IUD has a thread. So there have been quite a number of cases when they put a menstrual cup and they pull out the menstrual cup, they pull out the IUD thread as well. So if you have an IUD and you want to use a menstrual cup, you have to be very careful that when you take out the menstrual cup, don't accidentally pull out the IUD. So that's all. Of course, pulling out IUD, there's no risk, there's no danger, but only the trouble that you have to go back to see your doctor to reinsert the IUD. So it is troublesome, but there's no risk or danger. So the only risk that we talk about is the toxic shock syndrome. So if you're going to use a menstrual cup or even a tampon, always remember to change it frequently. So don't keep it inside for more than 12 hours. So that is the main thing about menstrual cup. But when I was looking at all the medical journals, then something came up very interesting, caught my attention. That is using menstrual cup for fertility. So those of you who have been trying to get pregnant, you must listen to this. Because if you try hard to get pregnant, this may be your solution. Because apparently, if you have had sexual intercourse before, you will realize that there are situations where most of the time after you have sex, you see the sperm will flow out, right? So the sperm flow out, of course, we say it's okay. Semen that is like 10 million, 50 million, 100 million of sperms, you still got like maybe another 10, 20 million inside. So it's okay to flow out, right? It should not affect your fertility. But in certain women, when fertility is already a bit difficult, when people find it difficult to get pregnant, there are some things that gynaes like to do. What we do, we give Clomid. Why we give Clomid is because we want to make you ovulate a bit more. So normally you ovulate 1 egg a month. If I give you Clomid, maybe you get 3 or 4 eggs a month. Then your chances of pregnancy go up, right? So now it's the same logic with this one. If I want to stuff a menstrual cup inside after sex, I will prevent a lot more sperm from coming out. So if you're going to have sex at night, after that you stuff it in, you keep your sperm inside your vagina, don't flow out through the night until the next morning, then you take out. That also increases your chances of pregnancy. So in that paper that I saw, they only took people who have been trying to get pregnant for minimum 1 year. They asked you to use menstrual cup. And what they found out, for first time, the chances of pregnancy with a menstrual cup, first 6 months of using it is 40%. Wow! For 1 year, you've been trying to get pregnant, you didn't get pregnant, and now you use the menstrual cup, your chances of pregnancy is 40%. That is for people who have never been pregnant before. But for women who have had other children, who have got pregnant before, but now it's so difficult. You know, there are women, first pregnancy, done. Pregnant, gave birth already. But after that, cannot get pregnant already. After that, they waited 1 year, 2 years. Why so difficult? Then they use this, then the pregnancy rate is 60%. I was like so amazed. So now we know menstrual cup can be used for fertility, can help you enhance your fertility and get pregnant faster. It's really amazing. But same thing, yeah. If you use a menstrual cup for sperm, don't forget to take it out in less than 12 hours, okay? Don't keep it there for 1 day, 2 days, hoping that the sperm, more chances are no. There is a safety issue that you need to remember. If you use a menstrual cup for fertility, please remember to take out in less than 12 hours, okay? Few things you need to know. That's what I mentioned earlier. There's actually not really significant increased risk of infection. So in the 5,000 over people who had use menstrual cup, the infection rate is actually very, very low. It's not really a problem. But if you're talking about hygiene, you don't need any special hygiene. Just wash it with water and soap and that's fine. Okay, you're putting it into your vagina, and please remember, a vagina is not a sterile organ. It's not really like a very, very clean organ, so that is why you don't have to worry so much about hygiene to the extreme. But of course, because this is going to contain blood, and we know blood is a good food source for bacteria, so when you remove it, you need to wash it cleanly, but just water and soap would be fine. You don't need any special way of washing this, okay? Washable, yes, washable menstrual pads is of course also very, very good because it's again environmental friendly, and it is also cost saving, and it's also good for women who have a lot of allergy. Just the same, more or less the same of why you want to use a menstrual cup and a cotton pad. The reason is more or less the same, but only thing, of course, I feel that this is a lot easier to wash and clean rather than the cotton pad. It's a bit more troublesome. It is possible, just a bit more troublesome to wash and clean. Yeah, I mean, if you see your hands got blood and you will panic, then of course, maybe it's not so suitable for you, because there are some people who are very scared of blood. That is true. They can't use menstrual cup. They also can't use tampon, because you pull out the tampon, also you usually see blood on your hands as well. But sometimes, if you keep doing it, you can, after some time, you'll get used to it. No matter how scared you are, you just keep doing it. Eventually you won't panic one. It's always like that. That's how you get rid of panic, you know, is to keep facing it until you're no longer panic. So I don't know whether you want to try. If you want to try, you may need some time to get used to it. In the vagina. Okay, yes. Number one, elasticity. No, it will not affect elasticity because your vagina is bigger than this. That's why I say put your finger in and explore and see how big the space is. A lot of people think the vagina is so tiny. Think about it, the whole baby can sit in your vagina. You know, the baby's head is so big, you know. So this thing is definitely not bigger than your vagina. So you don't have to worry. Number two, it is so soft. So most likely your vagina is going to compress it rather than it stretching your vagina, okay? So your vagina is going to end up compressing it. Yes, some women with very bad prolapse, they may have problem keeping it inside. So only in small number of people, if your prolapse is very, very bad. So you need to try it first, okay? You need to try it first, if not you won't know. Because you must understand, as more and more blood accumulates inside, of course this thing will become a bit heavier, and at the end it's still your vaginal tenseness that holds it inside. So if your vagina is really very lax and your uterus is like popping out, of course this thing will also come out lah. Okay, if you look at the studies that I read, there's so many papers out there, and in fact they gave this even to school girls in Africa, because in Africa they have, it's really a problem with this menstrual thing, okay, because they cannot afford those disposable menstrual pads that most of us use because it's so expensive. So they actually gave this to those girls. So honestly, I don't think there's any problem using this, just like using tampon, because I feel that women or girls should learn to explore and know their vagina. We should. So the more we say, don't give, and then when are they going to learn and know their vagina and their body? When? That's why many of women in Malaysia especially, because they have always been so worried, you know, to put things in or to put their fingers in, even when they are like 40s, 50s, with like 2-3 kids, and they have never even inserted their finger into the vagina. I got no idea what is that. No, it's not very good. It's important for us to know our body. So I have nothing against girls using menstrual cup, because number one, the hole is not really that small. All of us, even young teenagers, should be able to insert their finger into their vagina. So all of them, once they have menses already, their vagina should still be able to insert their finger easily without injuring their hymen. So sometimes it's good to explore. That's why tampon is not a problem. It is just one finger go in. But of course, this one sometimes I feel it is a bit bigger than just one finger. You should still be able to get in, but at the same time, it all depends on your girl, okay? So you can still use it for virgin, there is no harm, but it all depends on the virgin's comfort and confidence in their own body. During menses, everything dilates, okay? So our uterus is a lot heavier during menses. That could account to some what you are feeling. Maybe you have some amount of vaginal prolapse, okay, or uterus prolapse. So there is a bit of laxity. So you'll find that it tends to be heavier during your menstrual cycle. The uterus become heavier and heavier, and therefore you find that actually everything start to go downwards. So if I were you, I will work on my Kegel, strengthen my vaginal muscle tone. Yeah. So yes, when your daughter is having rash with sanitary pad, first option is, if you don't want her, it's not say I don't want you to put things inside of her vagina, but it needs a period of getting used to. But you can always use cloth pads, because cloth pads will not have all this rash compared to sanitary pad. The answer is very simple. You just take your menstrual pad and just soak it in the water for like half an hour or 1 hour, and then after that you cut the menstrual pad. You see what is inside. There's a lot of horrible things inside that is not cotton at all. So that is why it can cause a lot of allergy. So cloth pads should solve your allergy problem. Tampons also can. If it was my daughter, I will use step by step. I may try cloth pads first because that will be the fastest and easiest to settle. But of course, it's troublesome because she needs to wash her pad. But it's not necessarily a bad idea. Teach your daughter to wash her own clothing is always good. Okay. Number 2 is tampons, because tampons have many sizes and they are very, very small ones too. So you can first ask her to explore her own vagina, teach her to put in her own finger, and then slowly, once she can put in her own finger, then only she can put in the tampon, because tampons need to be inserted up to the extent that your finger is already in the vagina. If not, then the tampon is sticking out and it's very uncomfortable. But once it's in the vagina, they don't feel anything, then it's very comfortable. And then if that is fine, then eventually you can also introduce her to this, because this one is slightly bigger than tampon, so you still need a bit of adjustment and training to do so, okay? If you have missed some of my videos previously, do go to my YouTube channel, Dr. Tan City Clinic, subscribe and turn on the notification, and remember to like my videos. Okay, so that's all for today. Thank you, bye bye.